fatigue, or gas? What will today's symptom be? My loopy life with lupus. Hi guys, welcome back to another episode of my loopy life with lupus. I'm just gonna kind of give you guys a rundown of what happened at my appointments this week. So if you've been watching some of my other videos over the last couple of weeks, you'll know that over the last month and a bit, I've been dealing with some stomach issues of like diarrhea that at first I thought was the turmeric that I started taking at the same time that I started taking my Fortic, because I did read up that it can have that effect on some people. So I stopped taking that and I haven't taken it since, but I'm not completely disregarding it at all. I might reintroduce it once we get everything figured out, but I am starting to think it wasn't that now because the problems have continued well after I have stopped taking it. So it seemed to get better for a couple of days after I stopped taking it, and then it just continued on. And on the 21st of July, I started to get very bad nausea. I vomited like 3 times that day in a matter of a few hours, and then was super tired where like I couldn't keep my eyes open. So I thought I had caught a stomach bug, but no one else around me got this. No one else around me has been sick. So I don't think it's a stomach bug because it's still continuing, and we are now at 2 weeks after the vomiting issue happened. And ever since then, the nausea and diarrhea has increased. Thankfully, no more vomiting, but very bad nausea. My appetite has like dropped a lot. And yeah, so that's what's been happening the last 2 weeks. I did decide to stop my Fortic last week. I actually stopped taking it the night that the vomiting started, and I just thought if it was a virus, maybe stopping my immune suppressant drugs for a while might help kickstart my immune system so that it could fight this infection a bit better and faster. But I also thought, well, maybe my Fortic, because it can cause stomach issues as well, might be to blame, so I'll try not taking it for a while and see what happens. So I stopped it for a whole week, and surprisingly my joints stayed okay. They were pain-free. I kind of suspect that that had to do with the fact that I was pretty much bedridden most of the days because of the severe nausea, because whenever I get this nausea, motion makes it worse. So I'm best if I'm like laying still. That's what settles it. So I think that's probably why my joints were okay, because I wasn't really doing anything physical. But the stomach issues did not resolve. The nausea improved a little bit, but everything else still was going on. So I thought, okay, maybe it's not the Fortic. I mean, I've been on my Fortic before years ago. I actually was put on it in July of 2010. Thanks to me making these videos, I was able to go back and look at that because I wanted to kind of see what happened at the time that I was on it before and things like that, because I knew that the symptoms I'm experiencing now, I did experience when I was on my Fortic, and I was thinking to myself, maybe they misdiagnosed me with colitis, and maybe it was my Fortic all along, and now that I'm back on it again, I'm having a faster reaction because it's re-exposure. But in going back and looking through everything, I found out they were not wrong with my colitis diagnosis. They suspected my Fortic was the cause of the symptoms until I had a colonoscopy that showed I had lymphocytes in my intestines, and my Fortic is supposed to get rid of lymphocytes, essentially. So there's no way that my Fortic could cause that. I did tons of research to see if there was any link between my Fortic causing lymphocytic colitis, is what I was diagnosed with. And I guess at the time I never wrote down what kind I was diagnosed with, because in the future, when I started going to the lupus clinic, they would ask me if I knew what kind of colitis it was, and I had no idea. I just said, they said it was colitis, but that they thought was autoimmune, which was partly true. My GI doctor did think it was autoimmune related, and that's what was causing all these lymphocytes. And the weird thing with me, the rare thing with me, was that not only did I have lymphocytes in my regular, I guess, colon or bowels or whatever, but I also had it in my smaller bowel intestines, or whatever you call it, which is rare. So I was diagnosed with lymphocytic colitis, was put on Entocort, and I didn't get much further in my videos than that to figure out how long I was on Entocort for, but I think I was on it probably a year or two. I'm thinking it was probably like, yeah, I'm thinking it was probably 2 years I was on Entocort, which is a steroid. It's a low dose steroid though, and it does not have the same side effects as prednisone does, which was great. And it totally helped me, and I stayed on the Myfortic at that time. Then I was taken off Myfortic because they felt I didn't need it anymore, because I was originally put on it for kidney involvement, and those things cleared up, so they didn't feel I needed Myfortic anymore. So now I've been put back on Myfortic because of the lung involvement, and methotrexate is not as compatible with that condition, so they switched me onto Myfortic again to try and combat these lung problems I'm having. That's why I'm on it again. But it's just odd that my symptoms kind of started up a little not too long after I started taking it, and then they just got worse in the last 2 weeks, with now including nausea. But like I said, stopping it didn't really seem to do much. But then, because I had gone out walking on Friday and then also went to the park on Saturday, my joints were starting to flare on Sunday. So I started taking Myfortic again on Sunday. And Monday, I started getting nausea. It started to creep back up again. Tuesday was even worse. And by Tuesday night, when I got home from work, I had very bad joint pain, like widespread all over my body. And also started to get the chills right before I went to bed, which was weird. And yeah, so then Wednesday was brutal at work because I just kept feeling like I was going to throw up. It was the same on Tuesday at work as well. In the afternoon, it got really bad with the nausea. I kept taking my ginger Gravol. I do not take regular Gravol because it makes me drowsy. And the ginger brand of Gravol, and it is still the same brand, it's the Gravol brand, but they make an all-natural one that's made with ginger, and it doesn't make you drowsy. It usually helps me when I have my random nausea that will like sometimes happen, and I'll just pop one. I'll pop the highest dose, like, which is 2 tablets. I'll pop it in the morning, and by the time I get to work, my nausea is gone and I'm good for the day. And I just get that randomly throughout the year from time to time, so I always have this Gravol on me. Usually it works great. The last 2 weeks hasn't worked that great. Yeah, and so Wednesday, by about the afternoon, my joints were starting to feel better, but the nausea was still there. So Thursday, I went to the lupus clinic, and it worked out perfectly that I was scheduled to go then. because now I have these issues that I wanted to discuss with them. So it worked out that I was to go there this week. Of course, as I've mentioned before with the lupus clinic, you meet with a fellow doctor first. He goes over everything, then he leaves, talks things over with my main doctor, comes back in with my main doctor, goes over everything again, and then a plan is decided on, and then my main doctor leaves, and then if I have any refills that I need filled out, the fellow will fill out those prescriptions for me. So that's how it usually goes. So this time I had a new fellow, and I'd have to say, out of all the fellows I have seen over the last few years in the lupus clinic, he was by far the worst. To put it mildly, I thought he was a total airhead and had no clue what he was doing. He started off by going over the medications I'm currently on, and started off by saying I'm on methotrexate, and I was like, no, my last appointment here, we changed it to my Fortic. I mean, that should be there in my file that he had right in front of him. He then proceeded to ask me why I was on certain medications. Why was I switched to my Fortic? Why was I on naproxen? Why was I on this? Why was I on that? And most of these medications he was asking me about were prescribed by doctors at the lupus clinic. So it should all be there in my file. So that was really annoying. And then I proceeded to tell him what's been going on with my stomach and everything. And he seemed completely baffled. And then he asked me what I thought it could be. And I'm like thinking, I'm here to hopefully get the answer from you as a doctor. So I just told him, I'm like, I really don't know what it is. I didn't know if it was a stomach bug. I didn't know if it was my Fortic, or if my colitis is coming back. To me, it could be any of those three things, because the symptoms would all be the same, and I haven't a clue which one it is. So he looked all baffled and confused. And he then proceeded to say he doesn't think I should be. He's like, well, really, I'm surprised that you're still on naproxen if you have a history of colitis, because generally naproxen can cause GI issues. So it could aggravate your colitis. And I'm like, well, I've been on naproxen now for a few years, and this was prescribed by the lupus clinic. So he's like, okay, well, we'll discuss with your doctor, blah, blah, blah. He did an exam on me, but it wasn't very thorough at all. The one thing that always bugs the crap out of me is whenever I go to the lupus clinic, I rarely ever seem to have any joints flaring at the time that I go. So they rarely ever get to see joints affected. I mean, they have, but it's not every time. And so this particular day, I was actually doing okay. I had a couple of sore joints, but nothing major. And so he wasn't overly concerned about that. He said the joint pain could even be linked to my GI problems, because he said if it's my colitis flaring up again, colitis can also cause joint issues. It can cause the ulcer things that I keep getting on my tongue. So he said it could all be related to my GI issues. And so I was like, okay. He also, I also let him know that I had stopped taking naproxen for a couple of days before my appointment, as per requested at my previous appointment. And he's like, why would they tell you to stop taking it before the appointment? And I was like, well, they told me that apparently this is the new standard, that they ask you to stop taking anti-inflammatories a couple days before your appointment so that they can hopefully see what joints are affected. Like, I'm having to explain this to him. And he's like, oh, okay. I mean, this was news to me at my last appointment too. I have not done this ever, stop my medications before the appointments, because no one ever told me about it until the last time I was there. So I don't know. I don't know about that. I don't know if that was right information given to me the last time or not. But I mean, it was from one of the main doctors. It wasn't information given to me by a fellow. So I'm more trusting of the main doctors. So I think it's correct. Anyways, so that's what happened with that. So then he leaves the room, came back, said my doctor was busy with another patient. So we had to wait. I literally had to sit there in the office with him, looking at some other patient's file for about 10 minutes, maybe even longer, before my doctor was finally available for him to talk to. Left, talked to him, came back together, and basically my main doctor said it's important that I get in to see my GI doctor ASAP, because right now I can't take Imuran, because in the past Imuran elevated my liver enzymes and I ended up in the hospital for a week. So I cannot take that medication at all. I can no longer take methotrexate because of the lung problems. So they are reluctant to stop the Myfortic at this point without knowing for sure if that's what's causing this, because really he was saying they're running out of treatment options at this point with the Myfortic. So I'm like, okay. So he said for me to go see my GI doctor as soon as possible to get his opinion on it, because he said maybe it is the colitis coming back and I'll just have to go on the treatment for that. And then that way I can stay on the Myfortic. I mean, if it's the Myfortic, he was saying sometimes with Myfortic, people will get nausea at the beginning, but once they adjust to it, that will go away. So that's another option, is to just kind of keep with it and work through the nausea until it hopefully goes away. The diarrhea part, I don't know. Yeah. But I was like, well, I mean, obviously I was fine on it before, so I don't know why I wouldn't be fine on it this time. Although I had a friend of mine tell me that there was one time that she took a medication years ago and was fine, and then years later she was put back on it and had a reaction. So I guess anything is possible, really, and my body doesn't seem to be textbook by any means. So, and I always seem to be in that small percentage of people that have weird reactions to things. So who knows? So anyways, after all of that, he just said, if I want to, I can try again going off of the Myfortic for a few days. He has no issues with that. If I want to try stopping it again for a few days and just see if things clear up, and then try going back on it and see what happens, I can do that while I'm waiting for my appointment with my GI doctor. So then he left, and I went to start getting my refills written up by the fellow. And I mentioned I needed refills of naproxen. He then proceeded to say to me, oh, well, we don't recommend that you keep taking the naproxen at this time, because whatever GI issues you have going on, be it colitis or whatever, it's probably aggravating it more. And the first thing in my mind was like, well, why didn't my main doctor tell me this when he was in the room? So I asked him if my doctor agreed with that. He hesitated and then said, well, we had a patient just before you that we saw that had the same issues going on, and we took her off her naproxen. Yeah, so I was like, okay, yeah. And by this time, like, my doctor was off seeing other patients, so I couldn't, like, call him back in. But I know that I can email the clinic or call the clinic's nurse, who can ask my doctor any questions that I have, and they'll get back to me with the answer. So I am still taking naproxen. I am not going off of it until I get confirmation from my doctor himself. So it is the long weekend. I figure they probably won't be back there now until Tuesday. And that's when I'm going to contact and see if I can get confirmation on that, because I was like, okay, his response was really kind of weird. He really didn't say that my doctor confirmed that with him for my case. It was for someone else's case. So I was like, yeah, that's weird. So that's what's going on with that. I asked about getting prescribed Zofran because a lot of you guys out there that live in the US were surprised that I don't have Zofran on hand at home when I get random bouts of nausea so much. A lot of you guys out there that have chronic illness and you get random bouts of nausea, you say you have Zofran on hand anytime you need it. I'm going to tell you guys, here in Canada, it is really different. It's like pulling teeth to get anyone to prescribe you Zofran. All of the doctors will just say, take gravel, take gravel, take gravel. And that is what I was told again. Take gravel. We don't feel you need anything other than that. And so I was like, why is it so hard? Because last summer, I was dealing with the same kind of stuff. If you guys remember last summer, the first 2 weeks of August, I was sick. And then again, the first week of September. It was very similar to what I'm going through now. Which is kind of strange that it's like the same time again this year. And so if you guys remember that, I did eventually get a house call doctor, I believe, to prescribe me Zofran, but he only gave me 5 days worth because he said they don't like to prescribe a lot of it. So I decided to go to good old Google and try to figure out, why is it so hard to get in Canada? And apparently the reason is that in Canada, it's basically only approved for use of for cancer patients going through chemo and radiation therapy, and also for people who are having surgery. So they'll usually give you a dose of Zofran before you go in for surgery, and they'll give you some after if you have nausea after surgery. That's pretty much the only time it is prescribed. They said the odd time it may be prescribed for other things, but it's pretty much only supposed to be used for those two things. And on top of that, someone told me that a lot of people in the US will get Zofran when they're pregnant. Well, here in Canada, that's not allowed. They do not recommend women take it while pregnant unless the benefits outweigh the risks, but they usually do not recommend it. They also don't recommend it for children either. It's actually not approved for women. Yeah. So that's basically why. Oh, and then I found out another thing, and this I think is probably the main reason they're not giving it to me, which I don't understand why they wouldn't just tell me this is the reason why. But apparently it can interact with both of my heart medications, and it can cause heart arrhythmia, which I already have. So my guess is they don't want to give it to me because of my heart condition and my heart medications, but no one has ever told me that as a reason. But when I read that info, I was like, okay, that's probably why. So that's basically what happened with that. I was actually not too impressed with the whole visit and a little ticked off, to say the least. Then I went and got a drink, got my blood work and all that stuff done. Then I had an appointment with a dermatologist, and I don't know if I've told you guys about why I'm seeing a dermatologist. So I originally went to the dermatologist about the redness on my cheeks. because I wanted to know if it was a butterfly rash. They have determined that it's rosacea. So I've been on a cream for that. But then I went back to them because I have these itchy, kind of scaly bumps all over my scalp. And at first they were only in one area, and then shortly after starting the cream that she prescribed, more have come up. And she thinks it is a mild case of psoriasis on my scalp. So I have this ointment that I'm supposed to put on the spots twice a day. I usually have only been doing it once a day because it's a lot easier to get Alex to put it on for me in the morning. I just don't have time to put it on because it takes me forever to find the spots and make sure that I'm putting the ointment in the right place because I can't see what I'm doing. I'm doing it blind, basically. So it takes a long time for me to do it to myself. So they noticed an improvement. They're not as red and they are not as raised. So she thinks it's helping, but she said definitely if I could do it twice a day, it would clear up faster, obviously. But if I can only do it once a day, so be it. She just says it'll just take longer to clear up and to just, keep on with that. But basically right now, that is the last of my worries. Honestly, it's like low on my priority list right now because they're not itching anymore. So I guess the creams helped with that. So they don't really bother me. Right now, my main thing is getting my stomach issues sorted out because that is affecting me big time. So sometimes you have to prioritize your symptoms because, yeah. So things like little bumps on my scalp, you can't even really see them because they're covered by my hair. It's not a big deal to me at this point when I'm having like nausea that's affecting my appetite and affecting my ability to do my job properly and all those things. So like that is the main thing. So I've already called my GI doctor. I think I called right the same day on Thursday, but they may have already been away for the long weekend. I got voicemail. So I did leave a detailed message about what was going on and why I needed to get in ASAP and to give me whatever appointment they have available. If I have to take off work to get that appointment, I don't care at this point because something needs to be done. So I do have Entacort on hand because I saw my GI doctor a couple months after I had all those. Okay, sorry about that, guys. My battery died, both of my batteries, so I'm on my phone now. But I'm gonna wrap this up soon. I just was saying that after I had those bouts of similar symptoms last summer, I did see my GI doctor who prescribed me Entacort to have on hand in case things acted up again and I needed to start taking it. But at this point, with the medications that I'm already on, as well as the fact that I'm on a steroid inhaler and Entacort is another steroid, I'm not sure if I should be taking it. I mean, I've been tempted to take it, but I just want to make sure that it's okay to take it with the meds that I'm on. I mean, obviously I can take it with my Fortic because I did in the past, but I don't know about the inhaler and like naproxen and stuff like that. So I'm just waiting to see him to check and see basically, what I should do. Honestly, I think if it's colitis coming back, the only way they can be 100% sure on that would probably be I'd have to probably have another colonoscopy done to see if there's lymphocytes in there again. And I mean, when I had it, and I was able to come off the medication for it because I went into remission. But he said it could come back again at some point. So it could possibly be that. who knows? I don't know. I read up about it online, and the fellow doctor that I saw was right. Apparently, the lymphocytic colitis, it can cause joint problems. It can cause the ulcers on the tongue. So he could be onto something there. Also, they said that a lot of times it can just get better on its own without treatment and kind of like wax and wane and like come and go kind of thing. So reading that kind of almost made me think, like, I wonder if last summer it was a little bit of a flare up, but it did go away on its own. And maybe the same thing will happen this time, or maybe it won't. Maybe I will have to go on treatment. I don't know. It's kind of weird. And I mean, I have little bouts of stuff here and there throughout the year, and it's only like usually like one day I'll have a bit of nausea when I wake up in the morning, and I'll take the gravel and it'll be fine. And like other days I might have like issues with the whole bathroom stuff and whatever. So it could be that it's still kind of there, maybe just not as bad as it was before. I don't know. But that's basically the update of the week of how things went at my appointments, and hopefully I can get in to see my GI doctor very soon. It would be nice if I could get in next week. That would be, fingers crossed on that. That would be great. But that's what's happening. Today is Saturday, and I'm feeling not too bad. My stomach's still a little weird, but not as bad as it has been. I did stop taking my Fortic again yesterday just to see what happens. My joints have been okay, so knock on wood there. And like I said, I'm still keeping up with the naproxen until I get some confirmation from my doctor on that. So that's it. I've just basically been trying to take it as easy as I can, because I find it's when I start to do a lot moving around, that's what kind of gets the nausea going again. I haven't been having to run to the bathroom as often, so maybe that's a good sign. Who knows? We'll see. But that is it for this video. Hope you enjoyed this update. I know it was kind of long, but I had to rant a bit about this whole experience at the clinic, and that doctor was just, ugh. Anyways, that's it for this video. Hope you are all having a wonderful weekend. I don't know if it's a long weekend in the US, but it is here in Canada. So I don't have to work on Monday. So I am just going to enjoy this weekend and hopefully feel somewhat normal, if not totally normal, by Tuesday when I go back to work. And another cool thing is I don't have to start work until 9:30 both days this week, whereas I usually start at 9. So, and Margaret will be at a gymnastics camp in the mornings, so it'll just be me and Annie hanging out. And her mom said that either she will or she'll get someone to go and pick her up from the gymnastics class and bring her back to the house, because it's kind of far from the house. You have to, basically take a car there, which I don't drive. So that's cool. I get to just take it easy for the mornings, so that'll be nice. And yeah, so that's it for this video, guys. We will see you next time. Bye.